Okay, so thanks everybody for coming. I think we can start. Um, my name is Jonathan Reisman. I am a third-year medical resident in the specialty of physical medicine and rehabilitation. I am in the residency program at the University of Minnesota. Just as a disclaimer, while I love the University of Minnesota. My program is amazing. They're super supportive. This is just not a University of Minnesota production. So the thoughts and anything that I share here is not a reflection of my program or employer. That being the case, this is also not medical advice. And these are my opinions, thoughts, guidance. But as I will say many times throughout the talk tonight, fact check everything that you hear me say, because you should never bank everything that's super important to you just on what one person says. I think that I'm right a lot of the time, but I'm definitely wrong sometimes, and there's different advice that's good for different people. So that being the case, ask questions to a lot of different people, and double check your information, double check your sources. So we have bunch of different things that we're going to talk about tonight, and there's a bunch of different questions that have already been submitted. And if anybody has questions that they would like to submit, feel free to do so in the chat. But just to start off, I thought we would talk a little bit about sports medicine. And one of the reasons that I wanted to talk about sports medicine was because the field of physical medicine and rehabilitation, of which I am in, has so many different areas to it, and I kind of want to show what those different areas are. And sports medicine is definitely a popular topic and area of medicine that a lot of people are interested in. So what is sports medicine? It's really broad, and it's hard to give an exact answer like a lot of things. It can look like a physician on a field caring for patients on a bench. It can be somebody gets injured on the field and they go out and care for the patient, for the person. It can be working in a clinic. Somebody comes in after they've had a concussion. There's a lot of different areas of what sports medicine exactly can encompass. So to really understand it, let's talk a little bit about how do you arrive there? What does the training look like? So if you're a sports medicine doctor, you have to do residency first, and there are a bunch of different residencies that you can do to get to sports medicine. One of those residencies is physical medicine and rehabilitation, but then popular for sports med is family medicine, orthopedics, and emergency medicine as well. So there might be a couple of other ones, but those are the ones that I most commonly hear. So somebody would go to residency, train to be a family medicine doctor, and then obtain a fellowship in sports medicine. So sports medicine training, part of what it encompasses is you have to be a team physician or associated with a team. That's actually one thing that's challenging right now in sports medicine training due to COVID-19, is that there's not so much sports going on. And because there's not so much sports going on, there's not a lot of sports medicine happening with teams. So a sports medicine doctor is going to be trained in sideline coverage. Again, concussions are super important now, so a lot of training on concussion medicine, treating lacerations, fractures on the field, really anything that can come up in a sports injury. You can start to see why, depending on which type of residency you did, it might be more valuable for one aspect or another. Another really important thing in sports medicine now is the use of ultrasound. Use of ultrasound is important in a lot of different fields, but in sports medicine, it's important. Ultrasound, or what we call point of care ultrasound, or POCUS, is somebody comes into your office and you want to see what's wrong with them. You ultrasound them. You might be able to give them an injection on the spot using the ultrasound instead of a CAT scan or an X-ray or an MRI, which takes a lot of time to obtain the result. Ultrasound is really quick. You have to know your anatomy well, and in sports medicine, it's really important to know that musculoskeletal anatomy. In sports medicine, you know a lot of the exam maneuvers for shoulders, knees, really the musculoskeletal system. So if anybody has any specific questions about sports medicine, I'd be happy to go into that now. Otherwise, that's the brief overview of sports medicine. If you do a residency in PM&R, physical medicine and rehabilitation, and then go into sports medicine, I think that's a great combination, because in PM&R, you learn ultrasound, you learn injections, you learn the musculoskeletal system. It's definitely an area that you go into. So here, great question. Would you say sports med DOs use a lot more OMM? So for anyone that doesn't know, DO, and that's a topic that we're going to be talking about tonight, that stands for Doctor of Osteopathic Medicine. OMM stands for osteopathic manipulative medicine, and also OMT, osteopathic manipulative treatment. And would sportsmen DOs use a lot more OMM? So I guess that question is compared to DOs who go into something else that's not sports med. Probably, but not necessarily. And you'll see that it's going to vary. Clinical practice varies with different physicians all over the place. It matters where you trained, and it matters what kind of company you're working for or you're affiliated with. But definitely the application is truly high there for sports medicine and OMM. If you're somebody that's interested in obtaining a practice or career where you're going to be using a lot of your OMM skills, sports medicine is definitely an area where you can do that. If you think about it, sports medicine, they have to understand how the body works, athletic training, conditioning, proper anatomy, and then also areas where there's dysfunction. So you're going to have patients or athletes who are better with one leg than the other, one shoulder, the other, one elbow is sore, a hand is sore. So your ability to use osteopathic manipulative medicine on the spot and really provide relief instantly is certainly valuable in sports medicine. That's a bit about sports medicine. We do have a sponsor this evening, the Bitcoin Express. There's a YouTube channel, the Bitcoin Express. They talk about all different types of news and concepts that are relevant in Bitcoin, cryptocurrency. I found it to be a really good source of education for all things blockchain and Bitcoin. So worth checking them out, the Bitcoin Express. Now, the other questions, so I got a lot of questions this past week about research. Research is super important. It's always good to have research on your resume. But one thing that I definitely would suggest is a lot of the other questions that I've been getting is what do you do now during this coronavirus period where you can't get a lot of clinical practice in, can't get a lot of volunteering clinical experience? Research, a lot of the time, probably 99% of the time when you're a medical student or a pre-med student doing research, you're not actually treating patients. A lot of the research that somebody would ask you to do would involve performing literature reviews, looking things up, summarizing things. You could do those from the comfort of your own home. So as far as research goes, one question that I had was basically how important is research for your application? Another question is, how do you go about obtaining research? And again, really, these questions are valuable for both pre-med and med students that would be obtaining residency as well. So let's talk for a minute. Why is research important? So research is important because research is how medicine changes and medicine moves. We did speak a little bit about this briefly last week, but just generally, we have in coronavirus, there's lots of different therapies and ideas that different doctors have that they think are valuable and they claim help their patients. Well, if they were tested properly and they went through the appropriate research channels, we would be able to say with proof that this is evidence-based practice, and then everybody would be able to do it. But that takes really a lot of time, and there's a lot to understand, a lot to know. Research, what do we mean by research? There are a lot of different things that research means. Research can just be that you summarized an article for somebody, you performed research, you participated in research. It could be you made a survey and you sent that survey out to people. A research experience does not mean you published it. So you can make a survey, have research experience, work on someone's research project. It doesn't get published, so you wouldn't list it as a publication, but you would still list it as research experience. So research is certainly important, and I think that institutions, one thing to keep in mind is that when somebody is taking you into medical school or taking you into residency, in a sense, they are hiring you. Obviously, in medical school, they're there to teach you, and in residency, they're there to teach you also, but they want to see what you're also going to do for them. Good, successful institutions, they are only really successful and well known because of what they produce. So institutions want to accept applicants that are going to do a really good job, but also are going to help pay it back and make the institution proud. So research is important. How do you go about obtaining it? That was a question that I got quite a bit. So it's really simple. If there is a topic that you are interested in, that's going to be the first thing, because nobody wants to see that you did research and you didn't care about the area that you were performing research in. This entire process of getting into medical school, getting into residency, people want to see that you have integrity and you're authentically interested in what it is that you're doing. So nobody really wants to see that you went through all of these motions just to check off check boxes if they weren't really things that you cared about. And those are things that the interview is going to expose. The interview is the most important thing, but everything else gets you to the interview. So researching a topic that you're interested in. So there's a couple things you can do. You can ask doctors, you can ask professors. And again, research for medical school doesn't have to be for getting in. It doesn't have to be research that was in medicine. I did research in psychology before medical school, but there's research in lots of other things. You could do research in history, research in sociology. No matter what you're doing the research in, you're still obtaining skills and perfecting and cleaning your research skills, your literature skills, and it's valuable no matter what else that you might go into. So if you had a professor really of any subject, if you felt that you can approach them, or a doctor that you know, and you say, hey, do you have any research that you're doing that I can get involved in? If there's a doctor that you know, a resident that you know, a medical student that you know, easy thing to participate in research is, hey, do you have any interesting cases that you need help with writing a case report? A case report is another thing that gets published in journals, and it's when, let's just say in my practice, I had a really interesting patient and I wanted to tell people about what took place. So I type it up, perform a little literature review, type it up properly, submit it to a journal. That's a case report. So you don't have to be, experimenting on people to do that. So that's an area where a lot of times there are doctors, residents, they have interesting cases that need to be written up properly, but the one thing they don't have is time. So a lot of times it can be valuable to have a pre-med student, a medical student, help going through a lot of the studies, reading things, summarizing things. So case reports is definitely an area that I would focus on if you were trying to. And then another question is, that I've been getting is, how do I reach out to a doctor? So that could be for research, that could be for shadowing also. So how do I reach out? So it's really simple, the same way you would reach out to anybody. Be polite, be direct, show that you have some sort of background in what we're talking about. But hey, good evening, good morning, Dr. So-and-so. My name is Jonathan Reisman. I really enjoyed that talk you gave to us last night. As I am very interested in obtaining research opportunities, and I would love to contribute to any. Do you have anything going on that I might be able to help you with? Just get comfortable with putting yourself out there. You're going to get a lot of no's. There might be a lot of people that don't answer you. I don't think anyone's going to be rude to you. No one's going to be mean to you. If somebody was, that's their loss. But I think it's important in the medical field to get comfortable with putting yourself out there and just reaching out to people. And you'd be surprised that, people respect it. People respect if you do it the right way. Proofread your email, make sure it's good grammar, make sure that you spelled their name right. Nobody's going to want you to come join their research project if they think that you don't put in effort into your work. So just make sure that it looks professional and keep it short. Nobody wants to read a 10-page paper. Just be direct, be polite, say thank you, and take it from there. As always, you can reach out to me afterwards with any specific questions about any of these things that you have. Real brief, just again, for anyone that came in, just a short little disclaimer. These are my opinions. I am a resident in the University of Minnesota. I am not an admissions counselor. I do not serve on the admissions board in medical schools or residency. So I can give you my educated assessment on what is important in a lot of these topics, but I cannot claim that this is 100% perfect information or advice. Additionally, this is not medical advice. I do not give medical advice out over YouTube, and you should never take medical advice from somebody over YouTube anyway, because that's probably a bad idea. But again, that's not medical advice, that's educational advice. And then lastly, these are my thoughts and my opinions. These are not the opinions of my employer or residency program. So that was research. We talked about research. We talked about sports medicine. I do see that there are some questions coming in. I had the topics that I wanted to get to next, but let's just discuss some of these things while they're still relevant. So one, how many year residency and fellowship would it to become an orthopedic sports surgeon? So you go to medical school is 4 years. You do an orthopedics residency. I believe orthopedics is a 5-year residency. 4 or 5 One of those two, 4 or 5. And then for sports, sports fellowships are generally 1 year. So, that's going to be, again, 4 to 5 years. Next question. Do I need to be sure I want to pursue ortho from day one to have sufficient portfolio for residency in that field? So, orthopedics is a very competitive specialty. There is no denying that. So I would suggest that if you think you might want to go into orthopedics, get involved early and pursue it until you know otherwise. That doesn't mean you can't pursue something else at the same time. And I don't think residencies are expecting that day one of medical school, you're going to have everything figured out for yourself. But definitely orthopedics is something that you're going to want to get involved in earlier than later. If you consider, like everything in medicine, we're moving up the ladder. So let's just say you want to get into orthopedics, so you wanted to be the president of the ortho club in your medical school. Well, you don't just decide overnight that you're going to be the president. You probably wanted to be involved in your first year and maybe be the treasurer, and then in your second year, the vice president, and in your third year, become the president, something like that. So you're going to have to get involved, start doing research, start doing connections, try to go to conferences. There's no denying that that obtaining specialties is not super easy. It's competitive, and you definitely want to try to differentiate yourself in that area. But that's not just because you want to get into school or into residency. That's because you want to be good at what you do, right? I don't think anybody here wants to be a borderline physician or borderline success in their field. So if you want to be really good at what you do, the time to start is right now. Start becoming knowledgeable about your area. And that goes into something else. I'll talk about this, another week, but in general, whatever you believe runs the universe, whether it is a religious power, karma, just try to leave as many doors open in front of you and become knowledgeable so that you can see opportunities when they happen and seize them. Then we have, do you have to do a fellowship right after residency, and what is a fellowship exactly? Well, that is a great question. Thank you for asking me, because it's a good reminder to me that not everybody understands everything. So I appreciate I shouldn't say not everybody understands, but not everybody is aware of the same things. That's part of why I'm doing this, is because we're all aware of different things, and I might not know something that somebody learned in a different medical school. So it's good for us to talk. So what is a fellowship exactly? So after medical school, you do a residency. Your first year of residency is called an internship, an intern year. And then afterwards, you do your residency. That can be a general residency. It could be internal medicine, family medicine, or it could be a specialized residency already, like OBGYN, anesthesia, PM&R, which is what I do. Then you are, if you do OBGYN or anesthesia or something like that, you are already specialized in an area. And then fellowship is like subspecializing. That's what you would do after your residency. Or in the case of internal medicine, a primary type field, fellowship is where you differentiate yourself. Somebody that is a cardiologist would have done an internal medicine residency and then a fellowship in cardiology. So after residency, you're already a doctor who can practice. You can already work out on your own, but if you want to specialize in a specific area, that's what fellowship is. Fellowship continues to pay you the same way residency does, maybe a few $1,000s more. So you are definitely leaving money on the table that first year, at least, that you're doing fellowship. And then some fellowships are more than 1 year, depending on the field. Cardiology maybe is 3 years. So it really depends on what it is exactly that you're doing. I know gastro, GI, I think is 2 or 3 years. So that's what a fellowship is. Do you have to pursue fellowship right away? Technically, no, although, and there are definitely people who go back and change their path a little bit by doing a fellowship afterwards. But you can imagine, I'll use myself as an example. I'm 32. I have been in school essentially since I'm 18 years old. Well, earlier than that, but I've basically been pursuing the path for 14 years now. I'm 32 years old. I'm married. I have a little child. We don't make a ton of money on a resident salary. Doesn't mean you shouldn't become a resident. It's just, sort of the honest truth. And that being the case, fellowship, you're not making that much, and you have a lot of debt a lot of the times in student loans when you want to become a doctor. So I can see that it could be very challenging if you finish residency or you're out there practicing and you're making a couple $100,000 a year, and now all of a sudden, you're working for yourself, you set your own hours, and then all of a sudden to go back and do fellowship at that point, people do it, but I can just see that it's a little bit more challenging because it's probably hard to go from making all that money and having that type of lifestyle where you are the practicing physician to all of a sudden being sort of a student trainee again and leaving a lot of that money on the table. But there are definitely people that do it. You can definitely do it. I always say that if somebody is passionate about something and is motivated to do it, you should not let something stand in your way. So if you want to be a certain type of doctor and pursuing a certain fellowship sets you up for that, you should definitely do that. We'll do one more question from here and then move on from kind of where we were going on the menu here. This may seem obvious, but do you have to work with a professor/doctor to conduct research, or can you conduct private research? That is a good question, and I don't think it's obvious actually, because you can kind of do whatever you want. I mean, private research, so does that mean you're doing it on your own, you're the primary investigator, and you're still doing it through a university, or you're just doing it totally on your own, like you wake up tomorrow, make a cup of coffee and just start, making a survey. So one thing that's really important about research is if you want to be able to publish it and you want to do it ethically, and you have to go through an IRB, which is an institutional review board. So it's generally a good idea, if you're going to be doing research, have some sort of academic institution involved with you. But that being the case, that doesn't mean you can't be the primary investigator or one of the leads. I think actually in my medical residency, residents cannot be the primary investigator, so a faculty member has to be primary, but it can still be your project that you're driving. So what that might look like, if I was in your case, if this is what you're getting at, let's just say I had an idea, I wanted to take a survey, and we did this. I took an experimental psychology class when I was in undergrad, and as part of the class, you had to do an experiment. And so we did a survey, created a survey. We wanted to ask people a bunch of different things. We went through the school's institutional review board. We filled it out. We did it all appropriately with a disclaimer, and there you have it. We did research. And so find a professor that is willing to sponsor the work that you're doing. It really doesn't have to be anything crazy. You could have a 5-question survey. Your survey could be, how do students feel about distance learning? How do they feel? Do virtual lectures replace adequately what's in person? You can come up with any questions you want, as long as they're ethical and you go through it the right way. An IRB would probably approve it. If they wouldn't approve it, they would probably tell you why, and then you would just have to correct it a little bit. So reach out to a professor. And professors, doctors who are in academic medicine, they are going to think that the fact that you want to do research is super cool. They wouldn't be working in an academic institution if they didn't like that to begin with. If they are a doctor or a doctor, hold a doctorate, so they have a PhD in something, then they themselves have definitely done research or written a thesis. So they definitely should be able to guide you and help you in that way. So we'll get back to some of these questions more. The next thing, we've been getting a lot of questions about DO versus MD, and we spoke about it briefly this evening with one of the questions with osteopathic manipulative medicine. So one thing that I would mention is, so what is DO? So Doctor of Osteopathic Medicine, DO, and MD, medical doctor. DO is osteopathic medical school, MD is allopathic medical school. Historically, osteopathic medicine was very different than allopathic medicine, and somebody who practiced osteopathic medicine would maybe be viewed less prestigiously as somebody who practiced allopathic medicine. Over time, it's changed a lot. Nowadays, the last few decades, but nowadays even more so, osteopathic medicine doctors who have DOs, they are kind of viewed as equals, and there are times where they're better. Somebody can be a better doctor, if they're DO compared to an MD. Certainly somebody could be a better surgeon, somebody might be smarter, somebody could be a better communicator. What are some of the differences? Osteopathic medicine, I'm not going to go into the history of it now. We could do that another time if anyone cares. But generally, osteopathic medicine nowadays, what it means is you still learn the exact same medicine that an allopathic doctor learns. You still take board exams. Instead of taking the STEP exams, you take COMLEX exams, but many osteopathic medical students take the STEP exams as well. You still learn the same microbiology, pharmacology, clinical medicine. You still go through rotations. The difference is you have a lot more lectures that are additional. Those additional lectures view there's the three core tenets that a person is really made up of mind, body, and spirit. I think these are things that are pretty in nowadays. And I think whereas maybe when I was a kid, if you would tell your doctor that you wanted to start meditating, the doctor probably would have thought you were crazy and, laughed or something like that. We're obviously very different nowadays. Doctors, everyone really knows that meditation is super important for a lot of different reasons. So things have changed. We focus a lot more on nutrition now than things used to be in the past. So mind, body, and spirit, I think everyone kind of can agree, whatever the spirit means to you, it's an important part of health. So we focus on the mind, body, and spirit. We learn osteopathic manipulative medicine, which is hands-on technique to treating dysfunctions in a person's body. So let's just say my shoulder, was like this. There are ways that I could come into your office and you can instantly help me out and get more like that. So there's so many different applications to it. It's super valuable and rewarding when you can help somebody with it. There are benefits and weaknesses, strengths and weaknesses to each one. So definitely, I would say that the decision to pursue one or the other should be more personal, and it's not a one-size-fits-all equation. That being the case, it's no secret. The general public will still view an MD as more prestigious, but also that doesn't necessarily matter. Once you become a doctor, and as you get into this process of becoming a doctor, you realize that doing things just because that's what somebody that is not educated in medicine will think is valuable, that's probably not a good way to plan your career as a doctor. If I'm not mistaken, the Surgeon General is a DO right now, or the last one was. So there are lots of doctors of osteopathic medicine that do quite well. In the field of PM&R, it's really heavily dominated by DOs. Lots of program directors, program chairs, chief residents are doctors of osteopathic medicine. Anyway, I'm a doctor of osteopathic medicine. I'm still in a normal residency like my peers, some of which are DOs, some of which are MDs. If I had to go through it again, I would do the same thing because I think it was very, very valuable for me. But again, there's lots of different ways to analyze that, and different people's situations might call for one thing or another. We got through a lot of these things. I got a question this past week that was kind of interesting too, is how do you deal with competitive medical students or competitive pre-med students? And it's no doubt, and it's no secret that the process of becoming a doctor is very competitive. We probably have heard stories of one person or another, cheating on a test, giving somebody bad or misleading advice intentionally just to get themselves ahead, or not sharing notes, or that stuff. I personally never experienced that, and I'm happy to be able to say that my medical school was super supportive. Everybody kind of helped one another out in residency. We're supportive and we help one another out. But and in pre-med also, there were definitely some people that kind of kept to themselves and maybe wouldn't want to help you. But largely my experience has always been that people were willing to help one another. But I definitely have heard stories of people not being all that helpful, and maybe the opposite. But no matter what, there's no doubt that it is competitive. There are a lot more people that want to go to medical school than available positions. And then it's the same thing when you're applying for residency. There are, for every 10 people that want to become an orthopedist, maybe there are only 5 orthopedic spots. I don't know the exact numbers, but it's just an example. So it is competitive. One thing I will say is, again, I kind of mentioned this earlier, whatever your belief system is, respect karma. Don't hurt anybody, be nice to everybody. You maybe have noticed from the news or just from other things that you've realized, but nobody likes it when doctors come under fire for doing unethical things. So play by the rules, be nice. If you don't have anything nice to say, don't say anything at all. Don't badmouth your peers because they're also applying. Just try to do a good job. Focus on yourself. So to the person who asked that question, how do you deal with the competitiveness? I would say worry about yourself. And that's good advice for lots of things in life. And I know that so far, a lot of the things that we've been talking about through this show that I've been doing, which, by the way, this is going to be a weekly thing. So if you don't see me post on Instagram about it or something one week, this is going to be a weekly thing at this time. But besides for just the tips and information and knowledge for becoming a doctor, for getting into medical school, for getting into residency, I hope to talk about life in general and being a good person. When you become a doctor and you treat people, people open up to you and tell you lots of things, and you get a lot of life wisdom that maybe you wouldn't have at the age of 32, but you get exposed to lots of things, and you can have really deep conversations with some 80-year-olds. You see what works, you see what doesn't work. So that being the case, like I said, worry about yourself. You have to develop, in the process of becoming a doctor, you have to develop resilience, because you go through a lot of challenging times, and those challenging times don't go away. They change. The challenges change. You got into medical school. Well, medical school is really, really hard. And then you got to get into residency, and residency is really, really hard. And if you think when you finish residency and you're practicing as a doctor that that's going to be super easy, that's going to be really hard too. So you have to develop a way to deal with these things. And one of those things is you have to stop worrying about what the whole world thinks. Identify who's important to you. What does your family think? What does your close friends think? I wouldn't do anything that would make society not like me, so I'm not suggesting that you just go crazy and say whatever because you don't care what people think of you, but just, don't worry about everybody else. Don't worry about how much somebody else is studying, what somebody else got on the test. Keep in mind what you need to do to be successful. And another thing is, this is easier said than done, but it is not a race. I was 26 when I started medical school. Some of my classmates were 23, and some of my classmates were over 30. Different people have different lives and different challenges. Some people were born into families where their parents could pay for them to go to school. Some people had to make money on their own. Some people had to, take time because they had to care for a sick family member. Some people got a really bad grade, and just because of that one bad grade in their first year of college, they had to do a master's program to fix their GPA to get into medical school. Don't worry about the clock. Don't worry about the calendar. Just do what you need to do. Get good advice from lots of people. Like I mentioned, not everyone's advice is going to be good. So get a lot of it and decide and try to filter out what is good and what isn't good. But focus on yourself. Make sure you're happy. Make sure the people who care about you are happy and think that things are okay with you. Don't worry about what everybody else is doing. And then there was really another thing we had here that I got before I go to the next question that's down here is a little bit about PAs, physician's assistants. So I got one question about PA satisfaction in the workplace compared to MD satisfaction in the workplace. One thing, and another question I got was, are PA schools going to be, oversaturated? There's a lot of, or the field going to be saturated with so many PAs. There are lots of PA schools. So first thing that I would say is similar to what I just said about everything else. Worry about yourself. So if you want to be a PA and you think it's going to be really good for you to be a PA and being a PA is the right thing for you, then I would not worry about, how many other people want to be a PA. Now, disclaimer to that, if it was really the case that, you wouldn't get a job because of it, then that might be another story. But I would say that if your heart is in it, it's probably going to be okay. I don't think PA schools are going to be churning out hundreds and hundreds of PAs that are not going to get a job. So that's first of all. Secondly, I love being a doctor. I think being a doctor is great. I don't think it's for everybody. And it's not always for me. 6 days of the week it might be, and then Tuesday maybe is kind of a lousy day. That's part of life. You have to take it for what it is and realize that, you're having a moment, you'll get through it. But that being the case, I think they're both wonderful careers, PA or physician. And the question is, which one is right for you? As far as the jobs go, I think actually there's probably, again, I'm not a PA, so I would cross-reference this, but I can just share with you my line of reasoning. One of the rehab units I worked on, we had attending physicians, we had medical residents, and then we had a PA also. And the PA knew more than any of us. The residents, we might have known more about a few other, general things in medicine. But the PA who had been working there on that unit, they really knew a lot about that unit, and they knew more about that unit than I knew about that unit. So PAs, I think, and NPs, I would say in the same regard, there are a lot of jobs that I think that they could do really well, and I think there are companies that certainly acknowledge that and are looking to replace doctors with PAs and NPs in those roles. And when I said that there are a lot of jobs that PAs can do really well, I didn't mean that that's an insight. I think there's no reason to think a PA wouldn't do a good job. My point specifically was I think that there are some jobs that might make more sense to have a PA do than to have a doctor do. So I think it's a great career. You need to just see if it makes sense for you. But again, do it because it makes sense for you. Don't become a doctor and not a PA because you want to impress your uncle or your cousin who's going to look down at you if you didn't become a doctor. And I'm not saying that we should be looking down at PAs, but I'm just saying, do what you think makes sense. If you said you always wanted to be a doctor and then it turns out for your family becoming a PA is going to make more sense for you, then, don't worry about what everybody else thinks. Okay, so we can get back to another question down here from the chat. Could you talk a little bit about the program you started for pre-meds? So we were hoping to have the website up by today, but kind of like what I said about becoming a doctor, there's no rush, and don't do things if you're not ready for it. So we're still working on it a little bit. So I can briefly explain a little bit though what we are doing for pre-meds, and we have actually changed this a bit. So we're going to be focusing with this program on pre-meds and med students as well. And there's a reason for that. There's a number of reasons for that. One of which is, let's just say you had a question about taking the MCAT. Do you know that I did not take the same MCAT you're going to be taking? The MCAT has changed. Or what about, getting into medical school after coronavirus in a year from now? Well, I got into medical school before coronavirus. So somebody who's applying to medical school right now that gets accepted, they might have specific information that is more relevant or current than my information. I might have a few years on them and a bit more wisdom and the ability to place that, but we're trying to create a process where we have pre-meds and med students together, and the med students can mentor the pre-med students and residents can mentor the med students. And what it's going to sort of look like is we're building projects that are meaningful that pre-meds and med students themselves, depending on what area of medicine they're interested in, can work towards and contribute to meaningfully. So we're not just going to say, oh, you're a pre-med student that's home for the summer and you want to volunteer, but all of the volunteer things are closed. So write poems for the elderly so we can give them to them. Nothing wrong with writing poems for the elderly. If that's where your passion is, do it. But my point is that what we're doing right now is we're taking out some time to design a really, really great project that this is going to be what we think is a game-changing project for the medical community, and the opportunity to partake in it will probably not only be very fulfilling, but look very good on your application, which I know is still something that people care about, their application. And additionally, having content and video lecture, some other resources geared towards leadership, humanism, cultural competency, bedside manner, what I call and what many other people call the art of being a doctor, the art of practicing medicine. It's one thing to know the medical knowledge. It's one thing to know how to perform certain procedures, but the art of practicing medicine is something that people are becoming more and more in tune to. So we're going to be focusing on providing those experiences and education as well. And we think that participating in that is something that is going to be truly valuable to your career. And then because it's going to be valuable to your career, it is going to look good on your application. And again, that's how I advise you to go through things for your medical career, is to think, what will make me a better doctor? And how do I become a better doctor? How do I start building that now? And in doing so, it is my hope that by participating, schools, residencies, whether you're pre-med or whether you're a med student, they're going to say, wow, look at this individual, look what they did. Again, you're going to eventually have an interview with them and they will be able to evaluate that. So that's that. Again, I still think the other things that are that go into traditionally becoming, matriculated into medical school or residency are still important. So shadowing, obtaining shadowing where you can, volunteering where you can, all these different things like that are important. But I shouldn't say but so those things are important. And I think what we're trying to offer is something that can really help you stand out. And the other benefit of making it a pre-med and med program and including residents is that if you participate as a pre-med, there's no reason you cannot keep participating as you move through, experience the full spectrum, and in doing so, create an entire network for yourself that by the time you're out there practicing as a doctor, you'll have a lot in place already. We're going to be having information on a website coming soon. I do have the domain, but we're not putting it out there yet. So stay tuned. But that in general is the idea of what we're doing. We're taking our time with it because similar to what I've said last week and before, and kind of the advice that I've given so far tonight is I think that to use a baseball analogy, there are certain times that maybe a coach will tell you, bunt the ball. So, you're sacrificing so that the person can get from second base to third base. It's okay that you get out. I think there are other times in life that it's good to try to hit grand slams. So I think this is an area, at least for me, we want to hit a grand slam with it. We don't want to hit a single, double, or 3-run home run. We want to get a grand slam here. So we're taking a little bit of time, but I think that it's going to be something really valuable. That being the case, while we don't have the details for the website to release to you just yet, one thing that I will say is we are actively recruiting people that are interested in having leadership positions. So if you think that you would like to have sort of a leadership role responsibility, participation in this program automatically gives you a leadership role, that you'll have good, meaningful work to do, and definitely something that will go down on your application and resume. But if you're interested in participating, just reach out to me, let me know. And then I think that I have gotten through these questions. Oh, I did miss one here. With the current step 2 being pass-fail for upcoming med students, how does that affect specialty selections? So much like everything nowadays with coronavirus, nobody knows. And if anybody tells you they know, fact check it. But we can give educated guesses. So, tests are becoming increasingly more pass-fail. Right now, it's I think step 1 became pass-fail, if I'm not mistaken. So I don't know what's going to be with step 2. There are questions about what to do with the MCAT. I think people are aware that the quality of your physician is not made by what score they got on a 1, 2, or 3-step test 30 years ago. We have all seen really good doctors and maybe they didn't do well on their boards. And we've all seen really lousy doctors and maybe they were, the number 1 finisher in their class. So medical schools, residencies are looking for opportunities and ways to filter who they want to take. So I would say as far as competition, sort of like what I've been talking about, this art of becoming a doctor and identifying the specialty that you want to participate in and getting research experience in that area of that medicine. One thing we're doing through the program is trying to get people on a track towards a certain specialty with experience in that specialty. And if you would like, you can always shift, but at least starting you out somewhere. And so same thing that I would say for a resident. If you want to become an OBGYN doctor, well, if everybody's tests are pass-fail, it just means that you're going to have to distinguish yourself a different way. Now, ultimately, we arrive at the interview, and I think I should probably do an entire episode just on the interview alone, because even one episode is not enough for an interview. But ultimately, you will eventually arrive at an interview. And once you arrive at that interview, everything on paper goes out the window in many respects. Everything you've ever done, your tests, your experiences, they get you to that interview. And then when you're in that interview, it's what happens next. So that being the case, if everything's pass-fail, obviously other experiences that you have to make you stand out in one way or another. And another big component of that towards getting in there is your personal statement. I do believe that the personal statement probably needs to be its own episode, and then maybe letters of recommendation. We could probably combine letters of recommendation and personal statement in 1 week, but certainly will not address everything that goes into a personal statement in just 1 week. It's super important. How to write it, how to go about writing it is really, really important. So, but that being the case, try to distinguish yourself and try to do it in meaningful ways by absorbing yourself in the area that you want to get into and trying to participate meaningfully in that area. Eventually, you'll find yourself on an interview. They'll ask you a few questions. If you can reflect on it with passion, you hit a grand slam. And that's what I hope that anybody who follows kind of my platform will be able to do for themselves, because hopefully we'll learn a lot of the tools and skills to be able to do that. A big part of that is how we communicate. As I mentioned, I believe part of the program is educationally is going to focus on communication skills. Communication, there's so many different areas in medicine where communication is important. There's bad news, there's a tense situation. There's so much that goes into communication, and so how to say when you made a mistake, big part there in not getting sued. By the way, it's a pretty well-known fact that doctors who know how to admit when they're wrong and have good open communication and good bedside manner just end up getting sued less, or if they are sued, they're probably more likely to win their case. So I do see that there are some other questions. Questions about the program, I'm going to skip for now. Stay following on the YouTube channel. Anybody who hasn't yet, subscribe. We'll have more videos coming out besides for just these lives that will update you on important things. And then just stay in touch on Instagram. For now, we're going to be doing this show every week at this time. So, keep coming back. We'll have more information on it. So more information on the program to come. We'll get this question down here at the bottom, and thank you everybody for all the great feedback so far that you've been putting in the chat. I appreciate it. So we'll do this last question and then we'll answer. So as far as the Instagram page for the program, there's still just my personal Instagram account that's going to be used for that information. We are going to have an entire team probably focusing on communication and social media. So as far as an actual Instagram account for the program, to be determined for now, that would be my Instagram account, Dr. Jonathan Reisman, Dr. John Reisman, for the best information with keeping up to date. And then again, there's going to be a website to come and videos posted on YouTube. So subscribe if you have not subscribed. And then how do you get, and we'll finish here with this last question. Any other questions, feel free to submit to me throughout the week, and I can answer them next week, as I've done in the past. On my stories, I'm going to have opportunities for you to put the questions in. Sometimes I'll answer you those questions directly. As some people might be aware, I've answered questions directly to those Instagram stories, and sometimes I'll save them for this platform here if I see that a lot of people are asking the same question. So final question. How do you get a rec letter from a doctor in coronavirus times? Many medical schools require them, and shadowing does not allow students to get to know the doctor personally. That is a very good question. I'll give you a brief answer that's not going to be complete enough. And as I mentioned, we're going to talk about letters of recommendation coming up another week soon. But generally speaking, yes, letter of recommendation in coronavirus time. So if there are ways to build relationships with people over the internet and knowing people. So, for instance, I won't mention any names, but there's an individual who's been reaching out to me and talking to me and helping me build, work on this platform and helping to design our program and helping to do a lot of really important things. I never met this individual in person, but the way things are going, I could see myself writing a letter of recommendation for this person. So you can definitely build relationships with people, even if you've never met them. That's the brief thing that I will say. I said earlier in the beginning of the talk, put yourself out there, knock on doors, proverbially send emails, be respectful, follow that advice that I spoke about earlier. We'll talk more about that in the future. For applying to be part of the team, reach out to me on Instagram. Literally just say, hey, I'd like to be part of the team. We'll talk. I try to respond. Anybody in the chat can correct me if I'm wrong, but I don't think that there's an individual message I've gotten or question about any of this stuff since we've started that I've never responded to. I might not respond that day, but I'll respond eventually in a day or so. So reach out to me with any questions that you have. I will always answer you. If I don't think it's something that should be answered in the chat and instead should be answered during one of these live sessions, I will answer it in the live session. So thank you for everybody for coming. If you do have any last questions or anything, send them to me on Instagram. We'll save them for next week or another episode. For more knowledge and information about the program, more content for the program, subscribe on YouTube, follow the Instagram account in the meantime, reach out to me. Let me know how we're doing, by the way. Any questions or concerns, what you like about this, let me know. What you don't like about this, let me know. I know so far I've been the only doctor. I do plan on bringing in some people that are really, really good, that I'm friends with and that I've seen a lot of the work that they do. So, I'm definitely going to have some guests as we go through this, and we'll be able to provide a lot of insight and experience to answer a lot of other things. I'm in communication with a bunch of really, really cool, smart people that will be able to help you. So for now, the YouTube channel, Instagram, Twitter, if you have Twitter, reach out, subscribe, and we'll be in touch. Have an awesome week. Thank you. And let me know how we're doing. What can we do better? What's not so great? And what do you like? And what do you want more of? And any ideas for further episodes? If you have any ideas for topics that you'd like to be discussed in detail in another episode, if you think a certain topic itself should be, its own focus in another episode, let me know. Thanks a lot. Have a nice week. See you next week. Bye.